The canine adenovirus, also known as canine infectious hepatitis, also known as Rubart's disease. The occurrence is widespread. It's not frequent due to vaccinations. There is frequent seropositivity due to immunization. The canine adenovirus causes an acute disease in dogs, the Rubart disease, which leads to vomiting, diarrhea, bleeding, and icterus. Canine adenovirus also causes fox encephalitis, which causes acute hemorrhage encephalitis in foxes. They have nervous system signs, and the differential diagnosis is rabies. The vaccine is the dog vaccine. So the etiology of the disease. The pathogen is canine adenovirus 1. The general characteristics are, it has a linear double-stranded DNA, it's non-enveloped, it's widespread, and it's frequently asymptomatic. The epigenetics are, it affects Canidae, which are dogs, and Ursidae, which are bears. These are both susceptible to the disease. The severity can range from lethal to asymptomatic. It's less frequent nowadays, and it's shed in discharges and direct contact. Long-term carriage happens in the kidney, and maternal immunity to the disease lasts 3 months long. The pathogenesis of the disease. It enters the body orally or through the conjunctiva, and the primary replication occurs in the tonsils and the pyre patches in the small intestine. This leads to viremia in cell-bound lymphoid cells, which leads to the secondary replication, and there are 4 main target organs. Number 1 is the liver for hepatitis. Number 2, it affects the brain for encephalitis, mainly in foxes. Number 3, the kidney in glomerulonephritis, and the virus sheds in urine. And number 4 is the eye for uveitis and iridocytis. The process of the secondary replication leads to blood vessel damage of the endothelium, as well as the parenchymal organs, causing DIC and coagulopathies. The antigens and the antibodies cause immune complexes which are deposited in the eye, which can lead to blindness and causes blue eye disease. The clinical signs are that it affects animals from 3 to 6 months old. The peracute infection causes sudden death in 1 to 2 days. The clinical signs are enteritis, vomiting, diarrhea, the diarrhea is bloody, viremia, fever, lethargy, anorexia, hepatitis, which causes icterus, and central nervous signs, and coma. The encephalitis can cause ataxia, seizures, and convulsions. And the uveitis causes glaucoma and a cataract in chronic cases. And the DIC and coagulation disorders causes mucosal hemorrhages, tachycardia, and leukopenia. The lab clinical findings are leukopenia, lymphopenia, and increased liver enzymes. In the pathology of the disease, we can see an enlarged yellow liver, enteritis, and liver degeneration. We can also see edema and hemorrhages and gallbladder edema. In the histopathology, we can see smudge cell intranuclear inclusion bodies in the brain. For the diagnosis, the virus can be isolated in canine and swine cells. The agent to detect this is PCR, and for antibodies, it can be paired sera or immunoglobulin in a fresh infection. The differential diagnosis is canine parvovirus 2 for the diarrhea and canine herpes virus for the ocular signs. You give a supportive treatment, and for prevention, you give vaccination. You can give an attenuated canine adenovirus 1 vaccine, or you can give an attenuated canine adenovirus 2 vaccine for cross protection. You give it to the puppy at 3 to 4 months. The second disease is canine infectious laryngotracheitis, which is caused by canine adenovirus 2. It causes a local infection in the upper respiratory tracts in dogs. So the etiology of the disease, canine adenovirus 2 causes co-infections with corona herpes and parainfluenza, which causes kennel cough in dogs. The epidemiology of the disease, it spreads rapidly. It's very contagious, especially in crowded kennels. When dogs are kept alone, it's not severe. It's usually an asymptomatic infection. The problem occurs when there's a co-infection with these other viruses. The pathogenesis of the disease, it enters the body per os or airborne, and there's no viremia. The virus colonizes and replicates in the upper respiratory tract mucosa, causing rhinitis, laryngitis, and tracheobronchitis. The clinical signs are it affects young puppies at 3 to 4 months old, and there's mild clinical signs such as sneezing, nasal discharge, a dry cough, and salivation. The pathology is it's confined to the upper respiratory tract. There can also be pneumonia if there's a co-infection. The treatment is basic supportive treatment, and you can also give antibiotics for secondary infections. For prevention, you give an inactivated vaccine, a polyvalent vaccine for kennel cough. You give the vaccine after 3 months old because the maternal immunity lasts for 3 months.